Hello, I'm Dr. Sandra Freihofer. Welcome to Medicine Matters. The topic, ACIP, the CDC's Advisory Committee on Immunization Practices, what it does and why it's important. Here's why it matters. ACIP, the CDC's Advisory Committee on Immunization Practices, is a federal advisory committee. It was first appointed in 1964. It's charged to make vaccine recommendations for the entire civilian population of the United States. CDC then sets the adult and childhood immunization schedules based on these recommendations from ACIP. And those schedules determine which vaccines have to be covered without cost sharing by ACA-compliant insurance plans. ACIP also votes on which vaccines are included in the Vaccines for Children program. This program, created in 1993, has saved thousands of lives. It provides vaccines free of charge to children age 18 and younger whose parents can't afford them. In full disclosure, I've been a liaison to ACIP for nearly 20 years. In fact, I still remember my first ACIP meeting. It was in 2006, the day the new HPV vaccine, a vaccine to prevent cervical cancer, was approved. I also serve on several vaccine-specific ACIP work groups. Now understand, the dates for ACIP meetings are set years in advance. These are public-facing meetings. Physicians, researchers, and public health workers from all over the country clear their schedules to listen in. We had a 3-day ACIP meeting scheduled for the end of February. The agenda was posted several weeks in advance. Votes for meningococcal vaccines and chikungunya vaccines and flu vaccines were on the agenda. And at the last minute, the February ACIP meeting was postponed. Date, TBA, with no time certain. So in essence, the meeting has been canceled. The physician and public health community was somewhat in shock as this was happening. A group called the Partnership to Fight Infectious Diseases organized a sign-on letter plea to preserve the ACIP meeting. Many medical organizations and public health groups, including AMA, the American Medical Association, participated. ACP, the American College of Physicians, also issued an official statement of support. These efforts were apparently successful. The February ACIP meeting has now been rescheduled for April 2025. And there's more. ACIP meetings have always had time for public comment. That practice may also be endangered. On February 28th, news reports revealed HHS had announced in a document posted in the Federal Register plans to end public comment on agency actions. This essentially would eliminate public participation and comment in policy proposals and decisions. Now understand that in his confirmation hearings, Mr. Kennedy made a pledge to Congress promising radical transparency, and this is anything but that. The policy of soliciting public comment and feedback on proposals had been business as usual since 1971. That was when former Health Secretary Richardson began this practice. It's now referred to as the Richardson Waiver. Prior to the Richardson Waiver, this type of public input had been excluded under the Administrative Procedure Act. Removal of the opportunity for public comment and HHS rules has drawn pushback from the public. Patient advocacy groups have issued a sign-on letter opposing this decision. On a good note, vaccine-specific work group meetings have started back up, at least some of them. I serve on several vaccine work groups. My ACIP work group meetings for flu, HPV, and COVID vaccines have started back, but the immunization schedule work group has not yet been reconvened. For Medicine Matters, I'm Dr. Sandra Freihofer.